Good morning, everybody. I'm Congresswoman Diana DeGette. I'm the ranking Democrat on the Health Subcommittee of the Energy and Commerce Committee in Congress. And I'm here with my fellow committee members and soon-to-be committee members. And we're here to request a meeting with Secretary Kennedy about the devastating cuts that they have had to HHS in the past few weeks, jeopardizing research into life-saving diseases, vaccines, and disease detection. So we're going to go in there, we'll come back and tell you what we found out. Let's go. Good morning. I'm Congresswoman Diana DeGette. I'm the vice chair of the, the vice chair, let me start. I'm Congresswoman Diana DeGette. I'm the ranking member of the House Subcommittee of Energy and Commerce. And with me today are members of the Energy and Commerce Committee. And we are here, we went inside, we requested a meeting with Secretary Kennedy to talk about the extreme and devastating cuts to the HHS budget the last week. We have been asking to meet with the Secretary since February 13th of this year. When he was first confirmed, we asked him, we all signed a letter asking him to meet with us. Not only has he refused to meet with us today, he also refused to meet with us in the time almost 2 months since we requested this meeting. And we are members of Congress on the committee with oversight of over almost everything HHS does. We went inside just now. We were told by security that they were notifying his office, who would let us know if the secretary was available to meet with us. They had us stand in the lobby and wait, and no response whatsoever from the secretary's office was forthcoming. Nobody came down to talk to us, and nobody told us if the secretary could meet with us. This is all in the middle of a healthcare crisis in this country. HHS, Elon Musk, and Doge have fired 25% of the HHS workforce, which is 20,000 people. In the meantime, we have an unprecedented and devastating measles outbreak that's spreading throughout the country. In my home state of Colorado, we have 2 cases. We have 600 cases nationwide, and 2 kids and an adult have already died from this disease. In the meantime, bird flu is spreading throughout the United States. Something else all of us are deeply, deeply concerned about is the devastating cuts to biomedical research. The United States is the gold standard around the world. Everybody relies on us for cures for diseases, for finding cures for diseases like childhood cancer, Parkinson's, Alzheimer's, diseases that impact every family in America. Hundreds of worthy research grants have been canceled all across the country. And even worse, under the reckless budget plan that we're about to take up in the House today, the Republican Party want to cut $880 billion from Medicaid, which will come directly through our committee. And we all say, hell no, you're not going to take away health care from our constituents. In the meantime, the Secretary has touted unscientific and unproven cures like cod liver oil for measles. He owes us an explanation, and he owes us a plan for how he is going to preserve Americans' health and how he is going to hold people's health in the future. Dr. Marks, who was one of the researchers who actually helped us get a timely vaccine against COVID, said, and I quote him, "Truth and transparency are not desired by the Secretary, but rather he wishes subservient confirmation of his misinformation and lies." Think about that. A senior researcher said that about the head of one of our agencies. So here are our demands. Number 1, we want an in-person meeting with the Secretary as soon as possible. And number 2, as is the tradition and the regular order, we want him to come testify before the Energy and Commerce Committee and tell us what his plan is for keeping America healthy and for stopping these devastating cuts. My next speaker this morning will be Dr. Raul Ruiz.
Thank you. I want to thank Ranking Member Diana DeGette for getting us together today, and all my colleagues on the Health Subcommittee who fight every day to improve healthcare access and make sure that the American people have the accurate information and the resources that they need to stay safe. We are here to demand transparency. We want to have conversations. The Republicans in Congress, the majority, have abdicated their responsibility to hold the administration accountable. They're turning a blind eye. We will hold them accountable. We want answers to our questions. We want to know why, in the middle of a measles outbreak with over 640 cases, 3 deaths, the first case in the Coachella Valley where I live in over 7 years, why are they cutting the staff who are keeping us safe to do the research to help us administer the vaccines in the communities? 1 out of 4 people have been fired from the Health and Human Services. In addition to that, they have cut nearly $12 billion in funding that help promote the vaccine throughout our country. And this is despicable when we know that the most effective way of preventing measles is through the MMR vaccine. And we all know that Robert Kennedy Jr., Secretary Robert Kennedy Jr. have said numerous times his skepticism of the use of vaccines. However, after visiting a funeral of one of the children that died in Texas, he stated that the MMR vaccine is the most effective way of preventing vaccine. As a physician, I agree. But while he says that, he's still cutting the grants that help us move the vaccines to protect children from measles in Texas and other places in our country. While he says that, he's cutting the staff that work on the development of vaccines. So we need this answers. And while at the same time, he is promoting false information like the fact that like cod liver oil and vitamin A for the prevention of measles. We are seeing now vitamin A toxicity and liver damage in children who are taking vitamin A based on his misinformation. And so we need that open transparency to talk about why he said that. When children in America do not have vitamin A deficiency, they do not need vitamin A for the measles. Usually it's for people who have a deficiency. That they can help with that as a treatment. So as a physician, I would like to ask him those specific questions. And in the middle of all of this, how is he planning to help keep our children safe from measles and other diseases when they're about to cut Medicaid throughout our country, when our children rely on Medicaid for access to see a health physician to get their vaccines? So we're in a difficult time in our country where misinformation is running rampant. As Dr. Peter Marks said and Ranking Member Diana DeGette just mentioned, it has become clear that truth and transparency are not desired by this secretary, but rather he wishes subservient confirmation of his misinformation and lies. So this is confirmation bias, which is very dangerous, that a Secretary of Health and Human Services is working and manipulating the agency to prove his beliefs, his false beliefs, against the vaccine and other tools that we know are most effective in keeping America safe. So we're here to demand answers and to keep the American people safe and healthy. And I want to thank everybody for being here.
Mark Vesey.
Secretary Kennedy, your uncle, Theodore Edward Kennedy, spent his entire Senate career trying to help people get better. This was a man that had a child that had a very serious illness at a young age, cancer, and literally worked tirelessly in trying to help people in this country have health care insurance, understanding that he was blessed with tremendous resources from his family. Sir, you are deliberately destroying that legacy that your uncle left behind. I will tell you that. The people that you're firing, the people that for no good reason have been let go of their jobs, they've been illegally let go, that has to stop, sir. You're throwing these hardworking people out. These employees that have spent their careers trying to help make America healthy, and you sent them out like that, and it's wrong to do that. And while RFK Jr. is decimating the agency from the inside, people in my state, as was mentioned before, are dying and getting measles, a disease that had been declared eradicated, and now it's making a full comeback because of the crazy policies that are coming out of this building. There are 2 children in Texas that are dead now. And you going to visit them does not take away from the fact that it was completely avoidable. This absolutely did not have to happen. When you say things like cod oil and vitamin A, people take your words seriously, sir. You cannot do that. And to make matters worse, Dallas County, one of the most largest counties in this country, we've lost over $70 million to prevent things like infectious diseases from spreading in populated areas. So I want you to know, sir, that this is not leadership. This is lunacy. It's deadly. It's deliberate, and it has to stop. We are demanding an immediate meeting with Secretary Kennedy because lives are at stake. This has absolutely nothing to do with politics. This has to do with making sure that the American public can become healthy again and have confidence in this agency and that they're doing the right thing. We're not going to stand by and remain silent. We're going to keep pressing and talking about these things because what's happening under your leadership and coming out of this building is crazy. And next, from Illinois' 2nd Congressional District, Robin Kelly.
Thank you, colleagues. Robert F.K. Jr. must be held accountable for endangering public health. You cannot simply reallocate the work of 20,000 civil servants who tracked infectious disease, researched HIV and AIDS, approved vaccines, answered a hotline for new mothers suffering postpartum depression, and improved the health of Americans. These layoffs expose what DOGE and the Trump administration is targeting. They have fired experts in IVF and infertility, canceled research into maternal mortality, and eliminated programs dedicated to reproductive health. Donald Trump, if you remember, the self-proclaimed father of IVF, is a hypocrite. For over a decade in Congress, I have worked with the CDC, HRSA, and NIH to reduce pregnancy-related diseases. In the middle of our country's maternal mortality crisis, Trump and DOGE fired the people dedicated to saving moms and babies. RFK Jr. closed half of the HHS regional offices, and it doesn't take a political expert to see closures impacted only blue regions, including the Chicago office that served the Midwest. Those offices supported the health of 166 million Americans. They protected seniors, people with disabilities, and children with region-specific knowledge and expertise. In juxtaposition to DOGE's so-called mission, they closed the offices responsible for investigating fraud and waste in health. These layoffs are not efficient or effective. They are simply cruel. I would just say, RFK Jr. and my Republican colleagues, don't be cowards. Let's have the meeting. And with that, I'd like to introduce my colleague Lizzie Fletcher from Houston, Texas.
Thank you so much, Congresswoman Kelly, and thank you so much, Congresswoman DeGette, for leading us here this morning. I'm glad to be standing here this morning with my Democratic colleagues from the House Energy and Commerce Health Subcommittee to demand a meeting with Secretary Kennedy. But I'm sorry that we have to be standing here because he should already have been in front of our committee, and he should be explaining to the Congress and to the American people the changes that he is implementing in the Department of Health and Human Services. What we know is that he has already taken numerous actions to dismantle the agencies and organizations that fall under this umbrella of health and human services in our country that are essential to the health and welfare of all Americans. These are agencies that Congress has created, has directed through our committee, and has funded over decades to do important work for the health of Americans. Everything from the Centers from the Centers for Disease Control to the FDA. We really need to make sure that we know what is happening, why it is happening, and that we are able to communicate openly. We need truth and transparency. We've heard that today time and again. That's not what we're getting. This is about health care. This is health insurance. This is biomedical research and development, something we're so proud to do in my district. This is about mental health care as we are in a mental health care crisis. This is about food and drug safety and so much more. But the recent actions my colleagues have mentioned to fire people who work in these agencies, to cut program funding, and to redirect research threaten the health and safety of people across this country. And Secretary Kennedy needs to explain why to Congress, to the American people. We are their representatives. As we've already heard this morning in my home state of Texas, anti-science efforts that President Trump and Secretary Kennedy have promoted have led to the rejection of vaccines and to a measles outbreak that is unmatched, infecting more than 600 people across states. And we've already heard today 2 children and 1 adult have died from this preventable disease. As the head of the federal agency tasked with life-saving medical research, saving lives, and finding cures, Secretary Kennedy has cut funding and staff by 35%. That is not right. That is not what the American people want. And he is failing us and failing to use the tools that we have developed as Americans over the years to keep us safe, to make us healthy, and it is unacceptable. So we are demanding this meeting, and we are demanding a briefing, and we are demanding that he come before Congress and explain to us and the American people why he is taking these disastrous actions. And now I will yield to my colleague from Massachusetts, Lori Trahan.
Well, thank you, Congresswoman Fletcher. Republicans in Congress aren't just silent about what's happening in the building behind us. They're complicit. They said nothing as Elon Musk raided the Department of Health and Human Services, firing pandemic response teams, birth defect monitors, and chronic disease experts. They said nothing as RFK Jr. ignores the deadliest measles outbreak in decades, an outbreak that has already taken the lives of 2 children in Texas. And they said nothing as Donald Trump's reckless tariffs raise prices for our community hospitals and working families already stretched to the limit. The one thing they have found the will to do, cut nearly $1 trillion from Medicaid. That decision rips away care from tens of millions of Americans, including children with disabilities, seniors in assisted living centers, and families struggling to make ends meet, all to hand another tax break to their billionaire donors like Elon Musk. It's a slap in the face to hardworking Americans doing everything that they can to give their kids a better future. We're here today to do what Republicans in Congress won't. We're here to demand accountability from this rogue administration. And we're here to say to the people that we represent that we will not back down from this fight. It's now my pleasure to turn it over to my great colleague on the Health Subcommittee, Congressman Troy Carter.
Thank you all for being here, and thank you, Ranking Member DeGette, for bringing us together. Let's be clear. Our mission is clear. We want the Secretary to answer these questions for the American people. We will keep shining light on these issues. Rather, it's the National Institute of Health cuts that provide resource for dreaded diseases. LAHEAP that provides assistance in my home state for people who are in desperate need of keeping their homes warm in the wintertime. Making sure that measles and other dreaded diseases are being dealt with accordingly. We demand that the Secretary governs in the daylight. Do not hide behind these walls, Mr. Secretary. Come out and meet with members of Congress. Meet with the American people. United States Congress is empowered with oversight to make sure that the American people are being dealt with fairly, to make sure that resources are applied equally, to make sure that our communities are being treated with dignity. Mr. Secretary, this is not dignity. This is not respect. This is not communicating or governing in the light of day. We demand accountability. We demand that you show up, show your hand, defend your positions. Defend your positions before United States Congress, and defend your positions before the American people. The American people deserve better, and we will not stop fighting until you do. Next, we will have questions and answers.
One more.
I'm sorry.
One more.
Wasn't on there. I apologize.
I'm Congresswoman Kathy Castor of Florida. I want to thank Representative DeGette and my colleagues for coming out in front of and trying to get answers from America's leading health agency. We are demanding answers on why Secretary Kennedy, President Trump, and Elon Musk are inflicting such harm on American families and our premier research institutes. Back home in Tampa, researchers at the University of South Florida and the Moffitt Cancer Center have been cut on all of their research grants. In fact, there have been no new awards from the National Institutes of Health to help us advance the treatments and cures that American families deserve. Think of America as a patient right now. And what Trump and Musk have done, they've cut out the heart of this patient by illegally halting all research grants to our research institutions across America. They've cut out the brain because they've fired all of our scientists and all of the dedicated public health or drug safety or maternal mortality or you name it. All of those experts now are not on the job to keep America safe. And now they're going to go after our wallets because these folks here in Congress, the Republicans, are complicit. They now intend to cut health services through Medicaid to fund a massive tax giveaway for billionaires like Elon Musk, and we're not going to stand for it. We're going to demand answers, and that's why we're here.
Thank you. We all have a hearing at 10 o'clock, so we have time for about one question. Yes, ma'am. Oh, we have many plans, but we believe that he should and will come. The first thing that has to happen is that Chair Guthrie has to bring him before our committee to testify. And we've been demanding that the Republicans do not be complicit in this, and because they're just as concerned about biomedical research as we are. So we are not giving up. We need him to come and answer, and more importantly, we need him to stop these devastating cuts. Okay, one more question. Yeah. TBD, yes. Well, I mean, there's been no time frame for him to come and testify or even to meet with us. As I said, our letter that we sent to him was almost 2 months ago. Not only has he not come to meet with us, he hasn't even responded, just the way neither he or his staff responded this morning to 10 members of Congress standing in his lobby asking to talk to him about the health care cuts and the devastation that is happening to Americans everywhere. Thank you very much.